You know, when breathing gets tough, millions of people reach for an inhaler. And it might just look like a simple puff of mist, right? But it's actually an incredibly sophisticated tool in the fight for every single breath. So in this explainer, we're going to unlock the science behind these absolutely crucial medications.
I mean, it seems almost like magic, doesn't it? Just one puff, and breathing can suddenly get so much easier. But what is the actual mechanism? What's going on deep inside the lungs that makes it all work? Well, that's exactly what we're going to break down today. Okay, so here's our game plan. We're going to start right on the battlefield, inside the lungs. Then we'll meet the two types of allies in this fight, the fast-acting rescuers and the super strategic controllers. We'll dive into how each one works, and then we'll finish up with what is probably the most important part, the tactics for using them wisely. To really get the solution, you have to understand the problem first. So let's zoom all the way in and see what's happening when breathing becomes a real physical struggle. So, try to picture your airways as this huge network of tiny open tubes. Now, in conditions like asthma or COPD, certain triggers, things like pollen or smoke, cause these tubes to get all swollen and inflamed on the inside. At the same time, the muscles wrapped around them start to squeeze tight. It's like a two-pronged attack that narrows the passageway for air. And that squeezing action, it actually has a specific medical name, bronchoconstriction. This is the core physical thing that makes you feel breathless or wheezy or get that tightness in your chest. It's basically your body's defense response going into overdrive, and it's the precise enemy that these respiratory drugs are designed to defeat. And that brings us to our allies. See, this isn't a one-size-fits-all kind of situation. The strategy for fighting both bronchoconstriction and inflammation actually requires two very different types of specialists. Think of your respiratory allies like two different kinds of emergency services. On one hand, you have the rescuers. They're like the paramedics who rush in to deal with a crisis that's happening right now. Then, on the other hand, you have the controllers. They're more like the city planners and engineers working behind the scenes every day to make sure that crisis doesn't happen in the first place. One is for immediate relief, the other is for long-term stability. All right, so let's meet that first ally, your emergency response team, the ones you call when you are right in the middle of a breathing crisis. This is such a perfect way to put it. When your airway muscles are all clamped down and tight, the rescue medication is basically the key that fits the lock perfectly, forcing it to open up almost instantly and let the air flow through again. Now, the technical name for this type of rescuer drug is a bronchodilator. And if you break that word down, broncho refers to the airways, and dilator just means to widen or open something up. So it literally means airway opener. It's designed to directly counteract that bronchoconstriction we were just talking about. So how does it pull this off? Well, it's a pretty simple and elegant process. First, you inhale the medicine, which delivers it right to where it needs to be. Second, it latches onto those squeezed airway muscles and sends a powerful signal, hey, relax. And third, the muscles obey. The airway widens and boom, relief comes and fast. But hey, you can't win a war just by having a good emergency response team, right? You need a long-term strategy. And that is exactly where our second group of allies, the controllers, come in. And this right here is the key mindset shift. Controllers are not about winning some dramatic, sudden fight. No, they are the proactive peacekeepers. Their entire mission is to tackle the underlying inflammation, that constant swelling and sensitivity that makes the airways so quick to clamp down in the first place. So they use a few key strategies to do this. The main tool in the toolbox is something called inhaled corticosteroids, or ICS. These are really powerful anti-inflammatories that just calm down all that swelling in your airways over time. Then you've got long-acting beta agonists, or SABAs. These are basically long-lasting versions of the rescuers, keeping the airways relaxed for 12 hours or even more. And very often, doctors will prescribe a combination inhaler, which gives you both of those medications at once for a powerful 1-2 punch against both the swelling and the tightness. So the crucial point to remember is this. While rescuers get you out of trouble, controllers are what keep you out of trouble. For anyone with a chronic condition like persistent asthma, these medications are the absolute foundation of their day-to-day well-being. Look, having the best allies in the world doesn't help you one bit if you don't know how to use them correctly. So let's wrap this up with the most important part, using them wisely. It really all comes down to a few critical rules. First, you have to know your team. Which inhaler is the fast-acting rescuer and which one is the daily controller? And that controller, it has to be used every single day. Yes, even on the good days when you feel fine. That's the only way it can build up its protective shield. Of course, always follow your doctor's specific plan and try to pay attention to what triggers your symptoms. But maybe the most overlooked key of all is simply using the inhaler itself with a proper technique. Because without that, the best medicine in the world just can't do its job.
And why is technique so critical? Well, get this. Studies have shown that up to 80% of patients don't use their inhalers correctly. 80%. That is a huge number. And it often means the medicine is just ending up on their tongue or the back of their throat instead of deep down in the lungs where it needs to go. It's a massive but totally fixable problem.
And that kind of leads us to a final thought. We've gotten really good at reactive and preventative medicine. But what's next? As technology gets smarter with wearables that can track our breathing patterns and our environment, could we actually get to a point where an alert warns us of an impending attack, letting us act before a single symptom even shows up? Now that is the future of breathing freely. Thanks for watching.